Hello, I'm your host, Diona Doherty, and welcome to the V Revolution podcast, brought to you by women's intimate health brand, Balance Active. Today we're going to be decoding some of the weird, wacky and wonderful things about the female body.
And hi, I'm Dr. Priya, and today we're deep diving into the wider health impact of those intimate conditions, because let's be real ladies, we're all in this together. If anything we say concerns you, then please don't hesitate to speak to your GP.
Yeah, grab a cup of tea and let's revolutionise how we talk about women's intimate health. A topic that we're going to be speaking about today is really overlooked. I think it's something that's obviously very personal and individual, but it's that link between intimate health problems and your mental health. They can encompass so many complexities, and everyone's journey is completely different. But we're joined by a brilliant guest today who has a story that she's willing to share with us, thankfully, and that is the wonderful Jen.
Hi.
Hello, how are you?
I'm good, thank you. How are you guys?
Good.
Nice.
So you've obviously, you have a condition that you've very open about and you've been speaking a lot about, and obviously that comes with a lot of ups and downs, and it's a long journey. Do you want to start at the beginning for us and talk us through like your own sort of journey with health?
Yeah, so I have endometriosis, and until last year I had adenomyosis and fibroids. I had a hysterectomy to remove those last year. It started probably when I was 11, which I think a lot of people with those conditions would relate to, you know, the onset of your period, then these conditions kind of rear their head. But unfortunately it wasn't until 22 years after that I had my diagnosis. So yeah, 2 decades of a lot of pain.
What was happening at 11 that you had to wait for so long? Like what were the symptoms, I suppose, of so you would have had endometriosis then?
Yeah, potentially. That was my first symptom. It could be earlier. Nobody's really sure about the cause or sort of how early it starts. But yeah, so my first symptom, I just really vividly remember being curled up on my parents' bedroom floor, unable to stand up, straighten, screaming. Like,
in pain?
Yeah, so much pain, so much pain. So my mum took me to the GP, and I was put onto the hormonal pill and was kind of just told, oh, it's a painful period, it will take this, it will, you know, smooth itself out and she'll be fine. And then for 22 years, every time I would go to the GP and be like, I'm still struggling with this, I was invariably told things along the lines of, you know, either you're on the pill, so that's the best we've got, like just go home and deal with it, or, you know, basically stop being so dramatic. To be honest about it.
And where did the change happen? Like what clicked all of a sudden that someone took it more seriously for you?
So I came off the pill for no other reason than I'd been on it for 2 decades and just didn't really know what my body was doing underneath it all. And my symptoms skyrocketed from being kind of sort of focused around my period to every single day of the month. I couldn't get out of bed some days. I'd have to crawl to the bathroom. The blood loss was so bad that I would pass out, had to give up my career, pain so bad that I would be being sick. The pain started to spread as well, so it radiated down my legs would give way. I had to use a walking stick for 18 months.
Wow.
It got really, really quite bad very, very quickly.
And Priya, what is endometriosis?
So endometriosis is when there is tissue that is similar to the lining of the uterus, but it's found outside the uterus. So sometimes on the ovaries, sometimes on the fallopian tubes. And
it's not supposed to be there?
It's not supposed to be there, no. And this can cause a lot of pain, particularly usually during menstruation. You usually get it when you're on your period or like a certain time every month. But it can also cause pain during sex, generalised like pelvic pain. But pain is that big word. It can be absolutely debilitating, as Jen has told us about.
And it can be on every organ as well. It's been found on every organ in the body. So the eye, the brain, the heart, the lung, any organ you can think of, the skin, the umbilicus, so your belly button.
This extra tissue?
Yeah.
Okay.
Yeah, so the cause is unknown. So there has been like a genetic link, but some people say it's to do with this endometrial tissue travelling through the blood system and through the lymphatic system and getting to different places. So no one really knows the cause.
And I suppose that's what makes it so difficult to understand and so difficult to like diagnose as well, when it's seems like such a grey area still.
Yeah, very much. It's traditionally it's been thought of as a period condition as well, which it's not, but that has kind of led to it not being overly researched and funded as well.
Yeah.
I think
because only 50% of us have a period, so why would we fund it?
But also then that's led to incorrect treatment sort of pathways as well. So, you know, for a long time a hysterectomy was touted as a cure for endometriosis. We know now that it's absolutely not, because removing the uterus doesn't remove endometriosis. It's not the lining of the womb like we used to think. So
you've had a hysterectomy?
I have, because I had adenomyosis and fibroids, which are kind of very common conditions that can co-occur, not always, but they quite frequently do. They have a definitive cure, unlike endometriosis, which is a hysterectomy, which isn't a great cure really. It's quite a drastic one.
It is, yeah.
But in terms of quality of life, it was worth it for me, for sure.
Was it? And what is the difference in how you physically feel since having a hysterectomy than before?
So the only way that I've been able to ever describe adenomyosis pain is if you picture a bowling ball sat inside your pelvis and it is trying to crush your pelvis from the inside out. That's the only way I've ever been able to describe the pain of it.
Wow.
And when I came round from my hysterectomy, that bowling ball was instantly gone. It was just, it wasn't there. It's been a big relief. A big relief.
And so you said you had to give up your career. You were
a wedding cake designer.
Wedding cake designer, yeah.
Yeah, I did that for 9 years. But I don't know if either of you have tried to carry a wedding cake. They're really heavy.
Yeah.
And it's long days on your feet all the time as well. And it just got to a point where I physically couldn't do it anymore.
I'm sure it's like quite conflicting as well, because you're working in an industry that's so happy and everything's so chirpy, and you can't turn up to a wedding with this beautiful cake that you've made on someone's wedding day like crippled with pain. I'm sure that's like, they're like, well, that's not ideal for anybody, is it?
No, and you can't blow out either because it's somebody's wedding day, so you have to turn up and you have to be happy. And I've literally been like running to venues, bathrooms, being sick with the pain, and then coming back out and putting a massive smile on my face, even though inside I'm just like, not very happy. But it was hard, but it was the right thing to do, I think.
To let that go?
Yeah, it just got to the point where I couldn't carry on with it, and it led me to then doing what I'm doing now, to have that space to do that as well, which I never expected to be doing, but it's, I just love doing it, so.
Yeah, and obviously endometriosis for most people, I don't know for all, I'm not 100% clued up on this, but that leads to huge trouble with fertility.
Yeah, for a lot of people it does.
You know, and obviously if you've had a hysterectomy as well, and that's you know, carrying children is something that can't be an option. And I think most people, like I have a friend also who has endometriosis, and she isn't able to, she would be in too much pain to carry a child. Like that's just also not an option. And as obviously that's just a space that's not really talked about a lot, because we do talk about infertility to a level, but not like how wide a spectrum it is and the reasons behind it, you know?
Yeah, 100%. Especially in these sort of conversations, we tend to divide women into two camps. There's the women that really want to be a mum, it's their heart's desire, they would do anything to carry a child. And there's the ones that, no, not for them, that's absolutely fine, their choice, no, I'm cool, I'm happy. There's this huge void in the middle of forgotten people, I think, and I'm one of them, where I didn't know, maybe one day, but not right now. But I always valued that I would have the choice.
Yes.
And then when that choice is taken away from you, I don't regret my hysterectomy. I would do it again tomorrow because it was the right thing for me.
Yeah.
But I didn't realise how much I valued the choice to change my mind.
Isn't that incredible?
Yeah. And I didn't realise that until after I'd woken up from a hysterectomy, which was hard, especially because my sister-in-law, I love her dearly, but she conceived literally to the day of my surgery.
Did she?
So yeah, and I love my niece. I love all my nieces and nephews to like bits. But yeah, she conceived literally to the day. So it was like this perfect visceral reminder.
Wow, yeah.
Yeah, and we live really close as well, so it was literally like every week seeing each other.
And I understand that the choice being taken for me really highlights something that you didn't know that you wanted, or maybe you know what I mean, because I had IVF to have both my children, and that was my husband. We've been very open about it. My husband had a vasectomy after previously having had 3 children in a previous relationship, and so as far as we were aware, I didn't have a specific fertility issue, but we couldn't get pregnant naturally because he'd had a vasectomy. But I had never really thought about becoming a mum. It wasn't like I grew up playing with dolls, or growing up with this maternal instinct and I can't wait to be a mum. That was never really something I had thought too much about. But when I met my husband, and this option was removed. And then I seen him being such a brilliant dad to his boys. All of a sudden I was like, oh, now I know that I want to be a mum. But I hadn't have had that option removed from me so early. Would I have become a mum when I did? Would I have went through, you know what I mean? Would I have wanted it as much? And I think it's whenever you value having the option, like you're saying, and once it's removed, then you're like, oh, you know, your life looks completely different. You know what I mean? And you have a different path to follow and a different journey to go on. What has that sort of conversation been like, even just with yourself, as regards like the future?
It's been hard. So before the hysterectomy, I was in so much pain that I would flippantly just be like, get this thing out of me.
You don't,
yeah. Like afterwards, it's become a lot more nuanced, and I have become upset or emotional over the last 9 months since my surgery, especially seeing...
Was that only how long ago it was? Wow, that's really...
So my niece was literally
Just
born like
born?
a couple of... It's really fresh.
Wow, yeah.
And it has been difficult, but I think what I've realised is for my own sanity, I need to focus on the awesome stuff that I have in my life, not the stuff that won't be in my life, and to do more of that and surround myself with more of that. And that has really helped. Like, I met my niece for the first time and I literally went home. My husband bought me like a pack of Krispy Kremes for the car home because he was like, you're going to need those. And when I got home, I didn't sleep that night. And it was about 4 o'clock in the morning where I was just like, okay, right, I need to have a word for myself now. It's going to be tough. It's fine to feel whatever you need to feel. Like, don't try and block it or tell yourself that you shouldn't. But, you know, you are so lucky and you have so much in your life that you need to kind of focus on that. And so that's the kind of conversation, and I keep reminding myself.
And I suppose like there are so many women out there too who have probably had like endometriosis or had the option of having kids removed from their lives, but you know, that's okay as well, because my best friend never wants to have children. She's like, if you met kids, like it's, do you know what I mean? Like she's just not, she wants to, and as well, like that's becoming such a more popular way of living, I think too. Like there's this misconception all the time, like as soon as you get married, I'm sure when you got married, it was all the questions about family and kids and all this, and it's quite triggering to a lot of people, and it's rude, you know.
Well, one of the symptoms of endometriosis and adenomyosis is what's called endobelly, and it is, when you think of bloating, people always compared it to food babies, which really wound me up because it's not a food baby. It's an exceptional level of bloating and swelling. It's extremely painful and it's extremely obvious. So at some points I looked like I was 6 months pregnant and basically infertile. And somebody literally came up to me and said, oh, when are you due? And I was so uncomfortable. And my husband was like bracing himself to like, you know, come and rugby tackle me and remove me from this situation. And I just thought, right, okay, if I'm this uncomfortable, you can be uncomfortable too. So I was like, oh, thanks for asking, but I'm actually infertile. I'm like pretty barren, so.
Oh, wow.
And they looked really uncomfortable. But I was just like, if I'm going to be this uncomfortable, you can be too.
But it's like, people should never ask that question. Like they should never assume someone's pregnant or ask them. And like what people used to ask me, like when I actually was pregnant, and they'd be like, how far on you? I'd be like, and I would just drop, I'd be like, I'm not. And then make them feel shit about themselves, and I'm like, no, I actually am pregnant, but you're not supposed to ask. Do you know what I mean? Yeah. Just like, but it's that like thing that's expected. But obviously, like whenever you have an issue like endometriosis, a condition like that, that is like intimate as well. Like it's something that we don't, it's not like you go, oh, I have a broken arm, or something that people can see right in front of them, or something that people know a lot about. So obviously I'm sure that leads to a lot of like mental health issues where you're just like, you don't know how to explain a lot of things, I suppose, to people. And obviously you're now working in that field where you're educating people on endometriosis. And what was it that made you feel like this area needs work?
For a start, it took me 22 years to get a diagnosis. Yeah. And the average in the UK is 8, which is just...
That's bananas.
Yeah. It's absolutely ridiculous. And it's a progressive disease. So in that time, it's likely getting worse. Right. And like I say, it's on any organ as well. So I nearly had double kidney failure because it had wrapped itself around my ureters. So we're having this huge diagnostic delay.
Whilst you're getting more ill.
Whilst you're getting more ill. And then you get a diagnosis, and then people kind of assume, oh, great, now you get treatment. But you don't. Then there's the sort of the wait again for getting accurate treatment, appropriate treatment with specialists. So it's kind of, my reason for doing it was multifaceted. It came from my own personal experience. But then when I set up an Instagram account to kind of stop myself from going really crazy when I sort of had to give up work, I realized I am far from the only one going through this, and it's a very, very clever disease. It makes you feel like you are the only one and you're completely isolated and nobody gets it. And but the truth is there's hundreds of millions of us around the world. Like, you are far from alone. And when I realized that, I just realized, why aren't we getting any improvements? Why aren't we getting research? Why aren't we getting funding? We don't know what causes it. We don't have a cure. We have an 8-year average diagnosis time. Like, it's just, the more I learned about it, the more infuriated I got. And then there's the side of it that just nobody talks about, and it's like the mental health side of it, and the, you know, the impact that it has on your relationships and your finances and all this stuff. I think it's 1 in 6 women with endometriosis end up losing their job or giving up their job. Through
just like the physical incapability of keeping up those daily duties.
And the lack of support that would enable kind of flexible working or anything like that to allow them to carry up their duties. So the more I learn about it, the more enraged I got, and I kind of, that then impacted my mental health as well, because I was just getting angry and angrier.
Was it in there?
So I was like, right, okay, I've got to do something productive with all of this, because I am driving myself mad. And
that was like a full emergency.
It was just seeing that it's not improving.
Priya, why do you think there's such a long waiting time to get diagnosed? Like, why does this not receive the same attention that other medical conditions do?
So I think with Jen's case, because she was on the combined oral contraceptive pill, that's actually a treatment for endometriosis.
Okay.
And so that probably masked some of the symptoms, and because you were on it for quite a prolonged period of time, so doctors probably weren't able to pick up like what was actually going on. And in terms of treatment for endometriosis, I guess there was not on the NHS. I mean, there's the combined oral contraceptive pill, then you have progesterones like the Mirena coil, and I mean, and then you have the surgical treatment, which is actually removing the tissue, the endometrial tissue, or just having a hysterectomy. And so the treatment options are quite limited that you can get on the NHS, or that doctors are aware of anyway. And so I think this, I mean, in terms of, you know, the delay in treatment, I think it's more, actually, there isn't enough research into effective treatment. And so that's the real issue. And
then I suppose as well, it's about, like, if you're going into the GP with like these thinking that this is the condition that you have because you have all these symptoms, it's about possibly going in with like a diary, like possibly you've kept track of these things, so you're not really going in with like a vague conversation. You have kept track of your symptoms, and you're able to go with almost like a little bit of evidence and a little bit more information, because as we've said a few times on this podcast, like the more information you can give a GP, the easier it is for them to help you, because they're not mind readers. You don't know everything.
It's one of the main bits of advice I give people, is to track your symptoms and to track everything going on around your body, even if you don't think it's related, because there could be patterns, and endometriosis is a full body disease. It isn't just a period condition. So for 22 years, I was kind of going in being like, oh, I'm suffering with my period still. And that immediately then puts the GP in the mind of, okay, it's just a painful period. But when I went in, it was over the phone because it was around COVID, and I literally had an A4 piece of paper with symptoms all around my body. And the poor woman, I don't think I even paused for breath. I literally just read out this whole thing. And she was like, oh, okay, like, this is serious. This isn't what, you know, we've kind of understood. So yeah, absolutely, tracking your symptoms is hugely important.
And then obviously, like, the impact that endometriosis has on, I think you touched on before, on like your sex life and stuff as well. Obviously, it can be painful, and then you just obviously, I'm sure most people then just lose their libido because they're like, this is not worth it. Do you know what I mean?
It's extremely painful, or it can be extremely painful. It's not for everybody. And it's not always painful during sex either. Sometimes it's afterwards, and sometimes it could be 24 hours afterwards. It's not always instant. But yeah, it definitely feels like someone's just smacked you about with a cricket bat, in my experience. Which, you know, is great for my husband. He felt lovely.
A ball cricket bat. God love you. And what work are you hoping to do then in this field to try and change things, I suppose?
So I started, like I said, on Instagram, and it kind of very much was just about online advocacy and education. And then it kind of started towards the end of last year, that came offline. And I started doing talks for pharmaceutical companies, brands, University of Cambridge. I'm doing a project with them because at the moment endometriosis isn't formally on the medical school curriculum.
Oh, right.
Blows my mind.
Yeah.
Every time I heard it.
Especially when so many people have it.
Yeah, and it's meant to be our top medical school in the country. Like so it that blows my mind.
Is that where you went?
No, I went to UCL.
Okay.
we got to talk a little bit about endometriosis there.
Did you?
Flying the flag.
Okay.
But Cambridge isn't unique in that it's not formally kind of, you might hear it mentioned in passing in a webinar or a sort of a lecture, but it's not formally on most curriculums. So we're doing a project there to get it on there, and then hopefully roll that out across other medical schools and other curriculums. So yeah, it's about raising awareness, but also I kind of feel like the time for acknowledging that a problem exists is gone. Like, we've kind of had our decades, centuries even of that. We need to actually...
No, it's action. Yeah.
It's about action now and actually making a change, and I kind of feel like the more we can get into these institutions and these organisations, that hopefully... small change. It is small, like Cambridge University, for example, is 800 years old. It's not going to change overnight.
Yes.
But these kind of baby steps, if we take them consistently, I think we can actually start to make a change.
And again, it comes back to that conversation when it's something about women's intimate health that we immediately just recoil, because it's got to do with like reproductive organs or just like vaginas, or just we just don't want to talk about it that much in public. And I suppose talking about it more to people from such a young age helps that really like reduce that stigma as they get older. And talking to the people around you, like you've mentioned your husband a few times in a very flattering light, I might add. I'm glad you're still happy. Because you've said about him rescuing you a few times. So you're obviously in a lovely position that you have somebody in your life who's obviously very aware.
Yeah, I mean, he wasn't at the start.
Okay.
He was helpful at the start. He wasn't aware at the start. He will fully admit he never expected to reach 40 and to know more about these kind of conditions than, to be blunt, a lot of people that work in medicine. He's quite open about that fact that he has learned probably more than he ever wanted to.
He just knows it.
But he has been absolutely incredible. And I always say that, you kind of have your medical support team, because it is a multidisciplinary disease, so you kind of need a whole team. But you also need your team outside of the hospital as well. And it's particularly because it is such a far-reaching disease, like we've said, it affects your work life, your social life, your sex life, your financial health, like everything. You do need people around you that can help support you through that.
And it's wild, isn't it, whenever like one thing affects every aspect of your life. It's debilitating in every aspect. Yeah.
I lost myself completely. When my symptoms first got really, really bad, I lost any sense of who I was. I'd given up the career that I spent 9 years building. I had no confidence. My body changed shape. Like, I gained loads of weight. I didn't recognize myself. And I lost any sense of who I was. And my mental health went through the floor.
Did it?
Yeah, completely. I couldn't see a future beyond pain. And that feeling is so suffocating. So suffocating. And nobody thinks to be like, do you want some support? Like, do you want to see if there's a service we can contact? Like, nobody thinks to sort of say that. And it was my husband who was that again. And he was like, do you want, like, there must be someone that can help. And he was the one that then suggested like therapy and stuff like that, which was a massive help. I wish more people got therapy when they get sort of diagnosed with these conditions.
And were you, if you don't mind me asking, were you able to get therapy through the NHS?
Yes.
Because that's tough to get as well. And I know obviously in your position and what you've went through, I'm sure you were a really strong candidate of somebody who absolutely needed to have a therapist. But for a lot of people, it's really hard to get access to that, especially in an immediate way.
So there was a wait list, as there often is with most services, but I don't know how it works around the rest of the country. But where I am, you self-refer. So it wasn't sort of like having to prove your case to anybody or anything like that. You could self-refer, and then they kind of just ring you up and have a chat with you, and then they put you onto the right sort of pathway that they think will help you. I don't know whether that's the same for all around the country.
I don't know either.
No, I think it just depends where you're getting treated. But I mean, it just shows how much physical conditions, you know, pain, that kind of stuff can affect you mentally. And we see this a lot. And people, they just think, you know, they neglect the mental side and they just focus on, you know, the physical side. But sometimes with pain, you know, it just, I mean, you can throw so much at it, you get lots of pain medication, and it just won't go away. And then you have the mental health side as well, which occurs as a consequence. But then a lot of patients don't feel like they should be treating the mental side. They just focus on the physical side, when actually, as you mentioned, therapy is so useful.
Yeah, because obviously those are the immediate symptoms. Like, these are the physical pain, and this is what needs. And I need to have, like in your case, to have a hysterectomy and those sort of surgery or whatever treatment is. But obviously then the greater impact, because obviously you've had to give up your career and you've had obviously an impact on your social life as well. And what is it like with regards to your social life? How do you feel like that's impacted like your ability to, like, you know, go on holidays and go enjoy things with friends? And I'm sure there's probably events you've missed because you weren't able to be there.
So many events. And like, it's not even just saying no at the start, it's such an unpredictable condition as well. So you can sort of be kind of getting through day to day, and then you'll have a flare up, and then so you just have to pull out last minute, or you have to rush home in the middle of something because it's just not going to be pretty. We haven't been on holiday for 5 years, I think. And like, I understand this is a very privileged thing to say, but like, we used to travel a lot, like multiple holidays a year. So that is a big change for us. And I think what's easy to forget as well is that my husband's life got completely put on hold as well. It's not just my life. Like, he never ever makes me feel bad about this or anything, but like, his life did get put on hold, and his ideas for our future. And you know, you marry somebody because you want a joint and a shared future. So you know, he did have his own ideas of what that looked like, and it just, my diagnosis just completely obliterated all of it.
Yeah, I suppose that's something we don't talk about too, is the impact on somebody's condition on the people around them, whether they're caregivers or just people, a support network, I suppose.
He became the sole earner for 2 years. And I was the breadwinner before, so it was like a huge shift. So he became the sole earner. He would cook every single meal, he would clean, he did everything. He was basically my carer for 2 years, which is, it was hard.
And that inevitably, even though it sounds like you guys love each other very much, puts a strain on a relationship, because it's now, that's not the relationship that you first agreed to be in.
And it's certainly not one you expect to be in your 30s. But I think communication, it sounds really really cliche, doesn't it? But you have to be open about it. He has become really good at saying what he needs as well, because otherwise he just runs himself into the ground. And it's also coming up with kind of like a strategy and a plan when you aren't in super high amounts of pain, because like he's like a fixer, so he wants to fix, like, make things better and do things practically to help. But if I'm in, like, lying on the floor screaming amounts of pain, I cannot articulate that, so then we start getting frustrated, and that's when there's a clash. Whereas when, you know, things are a little bit calmer, we've had a chat like, oh, okay, this helps, that would help if this symptom's arising, then he just goes off and gets it, and then he's like, I've helped.
Oh, fair play. I mean, that's he has a good egg. It sounds like he has a good egg, but it's tough whenever, like, even if my husband and I too, we have to, like, communication has to be the most important thing in our house, and I only realise that now after, like, we have our family, and just like the day-to-day life is so hectic and so busy, and you know, we have very different ways of communicating issues to one another. Like, I will just say it. My husband will sulk all day until I eventually be like, what is wrong? Like, tell me. And then he was like, there's no point in not listening. Like, he'll tell me then. But like, we obviously have very different, but you have to find that middle ground of a way that works in your own household, especially if somebody has like an advanced health condition that needs like specific care all the time, and then your whole relationship dynamic is changed, you know. So obviously I appreciate the strain that puts on a relationship, and I suppose probably that's about, you know, building that network of people too around you that you can rely on.
Absolutely. And I mean, a lot of people that do have these like intimate conditions, they come into like the hospital and see a GP, and they don't really want to talk about it, or they're quite embarrassed.
Yeah.
But actually, you know, as health professionals, we've seen it all. You know, seen absolutely everything. Things that you can't even imagine that we've seen. We have seen.
Tell us. What's the weirdest thing you pulled out of an ass?
God. I've got this image in my head.
That's God out of someone's ass?
No. But the point was
sorry,
you know,
I took that to the sewers, didn't I?
You can talk to us about anything,
yeah.
And we get it. Look, well, we might not understand, but we will try our best to, and you know, that is the first step in us understanding, just by being open and talking to us, and that way we can offer you our support. And obviously it's important to have support outside of the medical field as well, as you were saying. But I
think especially people who like struggle with infertility for lots of different reasons too. There becomes like I had a network of people that I communicated with whenever I was going through IVF, but they were all online. So I didn't know who anybody was in real life, and that's just an example of how people just didn't want to do it talk face to face about this sort of thing, and it's easier to sort of talk to an avatar online than a real person. But I specifically remember a woman that I spoke to who was anonymous, but I spoke to her all the time, and she was from near where I was, but she was also going to do her fertility treatment in the same place in the Czech Republic that I went, the same clinic, the same week. It was so nuts. But this was her last chance still in. And I had lots of frozen embryos, and we didn't know each other, but this sisterhood that built for us going through this specific thing together. But she didn't speak to anybody about it, or just her and her husband. They didn't talk to anybody about the fact that they had struggled for a decade to have children, and they really wanted to build a family, and they didn't speak to anybody. And I remember this, like talking to my husband going, I'd rather hers work than mine right now, because I knew it was her last chance, and I knew that I knew that she really wanted to have a family, and I remember just thinking, I just really want hers to work and not mine. And hers did work and mine didn't at that time, but I went on to have my own kids then. But hers worked that time. I remember just being so happy for her, because she didn't speak to anybody about it. And I've always been I'm so sorry. Oh, no. I've always been very open about it, which meant that I always had lots of people that I could speak to, and was very, very happy to talk about it, and very like open, and therefore I had that support. But there's so many people that don't. There's so many people that just keep these things to themselves, and so sorry, and don't and just sort of struggle on their own. So thank you so much.
You don't need to apologise. You know, these are, you know, we're in this together.
No, I'm okay. But the point that I'm trying to make is that there are so many people who don't have a support network. They don't have anyone to speak to when they have intimate health problems, when it's about their fertility, about their sexual reproductive organs, about their vaginas. They don't speak to anybody, and it can be such a lonely place to be for some people, you know. So obviously, like, the message there is just to find somebody. And as you say too, you could speak to a health professional who has seen anything. And nothing you can say to that person will make them judge you or feel or be surprised. Like, yous have seen it all, I'm pretty sure. Yeah, sorry about that. Yeah, but it's just like that. I think it's that sisterhood that we have as women. You know, when you see someone go through, when we all understand. It's, let's be honest, I think it's much harder to be a woman than be a man in this world. We have way more things to contend with, way more. You know, you start having a period, and then you might have to go through pregnancy, and then you might have to give birth, and then you might have menopause, and just all these things, and men don't usually have to experience any of that. So I feel like whenever you're in like a sisterhood of other women, we all hopefully have each other's backs when it comes to these sort of medical issues, and that we can hopefully support one another. And that's what's great about a podcast like this, is it's just, there's so many, a variety of stories to hear, you know, especially someone like yourself, Jen, who's so willing to talk so openly about it. So we really appreciate that.
Thank you. I think it's the first step to breaking it down, isn't it?
Yeah.
Just actually talking about it and not feeling like you are alone, because like you've just said, we're not at all.
Yeah. And what does your day-to-day life look like now that you're like hopefully at a better side of endometriosis, would you say?
So if I'm honest, I've not had a pain-free day since my surgery still.
Okay.
But the thing with endometriosis is you can cut out the lesions, but you then still have to unpick all of the rest of the pelvic pain generators that disease has caused or contributed to. So in my example, it was 22 years of that disease growing in there. That has a lot of implications on the surrounding organs, the surrounding tissues, the surrounding muscles. You know, it distorts things, it creates hypertension in the pelvic floor. It can cause havoc where organs have been pushed out of place or pulled out of place or constricted and choked. So it's a long journey. It isn't as simple as, you know, have the surgery and it's done. We don't have a cure, and that includes excision surgery. It's not a one and done thing.
And can it reoccur? Like this tissue can come back, obviously, like, you know.
Yeah, so it can reoccur, and also it has many different presentations. So sometimes it's red, sometimes it's black, brown, sometimes it's transparent. So obviously a surgeon will go in and remove all visible disease, but if some of it wasn't spotted or, you know, presenting itself at the time, then obviously that can then proliferate and grow as well. So it is a lifelong condition, unfortunately.
and you mentioned earlier that you had 2 surgeries.
Yeah.
And the first one didn't manage to remove all the tissue.
Yeah.
As well as the physical impact, what kind of mental impact did that have on you?
I think, so just to recap, because I think we had that conversation ourselves, didn't we? Yeah. So my first surgery was May 22. There are 2 types of endometriosis surgery. One is called ablation, where they kind of burn the sort of surface layer off, if you think of like a weed, but they leave the root. And then the other, which is the preferred type, is excision surgery, where they go and they cut out the disease.
Oh yeah.
So my first surgery, unfortunately, was ablation. I didn't know the difference at the time.
Is one usually more successful than the other?
Excision.
Okay.
Yeah, but ablation is more widely used.
Okay. Why is that?
I think there are less risks with ablation. Yeah.
And also true endometriosis specialists aren't as common as we would like.
Okay.
And they tend to use excision. And so I had ablation the first time, and also a large amount of endometriosis was still left after my first surgery. And at the time I was so hopeful. I was like, oh, finally someone's listened to me. I'm going to have, you know, surgery. I'm going to be feeling better. And that never happened after my surgery. I was still in so much pain. And I went to that surgeon and I said, something's still not right. Something's going on, it's not right. Yeah. He basically told me it was in my head, I needed to calm down. He'd gone to medical school, not me. It was pretty bad. Yeah, wow. It was pretty bad. And I mean, I know I talk very highly of my husband always, but we left that appointment and he was like, well, Jen, he did go to medical school. Like, you didn't. Yeah. You're very educated, but you didn't go to medical school. Maybe he's right. Yeah. But he was like, if you want to get a second opinion, 100% support you, let's do it. So we found a very advanced specialist in endometriosis.
Right.
He did an MRI a few months after my first surgery, and he was like, you're at risk of double kidney failure. You've got deep infiltrating endometriosis pretty much around your whole pelvis area. Your womb is very diseased with adenomyosis, so hysterectomy is probably the best shout. You also have fibroids, which was undiagnosed, completely missed, and you possibly also have it on your bladder, your bowel, your liver, and your diaphragm. All of that missed. And the impact, I think the impact endometriosis has, especially when you get a diagnosis or you get answers like that, it's so complex. I mean, we're all human adults, we can hold more than one emotion at the same time. Mm-hmm. And it's hugely validating, because you're like, I'm right. I wasn't going crazy. I wasn't weak. I wasn't just unable to cope with the pain, you know. Yeah. But then it's also crushing, because you're like, okay, now I have to deal with all of this. I've just been through a surgery. I thought, you know, that was going to be it. And, you know, it's very, very complicated.
Absolutely. And I mean, with pain, especially chronic pain, so many people suffer with chronic pain. Mm-hmm. I mean, from a huge range of different causes. But sometimes the pain, you know, it just doesn't go away. You can remove every single organ in the body and there will still be pain. And so it's so important when this happens to seek the right kind of support. Yeah. And whether that's physical, you know, from doctors, from people who can, you know, help the course of your condition, like help change that, but also the mental side. You know, did you seek any support when it came to?
Yeah, so I think as well, the mental health side is so important, and I am so grateful that I was able to access support. But what happens a lot of the time is that the mental health side can be pushed, and then as a way to almost dismiss the physical side. And so there's definitely that balance to be had. I think it should always be offered in conjunction with a proper treatment plan to address the physical side and the cause and the root cause and all that side of it as well, rather than you know, using it as a, I mean, like my first surgeon told me, like, you need to calm down, I think it's in your head now.
Honestly, surgeons are just renowned for sometimes just being bad with their words, and
that's such a doctor thing to say. We hate the surgeons.
The
paediatricians are class, we hate the surgeons. It's like such an in-joke, isn't it?
Yeah, I've been told some things. Definitely been told some things.
But I mean, there is great support from charities like Endometriosis UK. I don't know if you've used any sort of thing.
So I actually found the biggest support for me personally was just through Instagram, like social media.
Finding like a community of people who are in the same position.
Yeah, absolutely. And like I said at the start, like, it's so clever at making you feel like you're the only one. And so just to know that these people were kind of like going through it and understanding. And actually some of the people that I met really early on Instagram were the ones that pushed me for a second opinion as well. They were like, no, like, this can be found on organs. And I always kind of like joke, Instagram saved my organs. Because without...
That's like a t-shirt slogan.
I know, right? Where's Meta? Where's my brand deal? But like, yeah, I fully would not be in the place that I'm in right now if I hadn't met those people going through endometriosis.
I regularly think about pre-internet era, pre-Instagram, like pre-having that knowledge at your fingertips. And as you say, like a condition like that makes you feel like you're the only person that has it. And pre-internet era, I'm sure everyone thought they were the only person that had it because that information wasn't as accessible as it is now, and you couldn't like meet other people who were going through the same thing as you, and that must have been such an isolating time.
So my mum had endometriosis.
Did she? So is it genetic?
As with anything to do with endometriosis, we don't know.
We don't know.
There is like a higher incidence. Correct me if I'm wrong, please.
There is a link between.
But it's not proven to be hereditary as far as I know. But yeah, so my mum had it, and she unfortunately was in the era where hysterectomy was told to be the cure for endometriosis. So she had like a complete radical ovaries, everything out, when she was probably around my age now. But of course she still has pain now, but we now know the hysterectomy wasn't a cure for it anyway, so the chances are that she could still have it.
So did the hysterectomy help her at all?
So yes, it did, but what we think happened is that she also had adenomyosis, which is, if you think like endo is misunderstood, then like wait till you get into adeno. So we think probably what happened is that she had adenomyosis, so she felt the instant relief from having that removed. Because she then said that she did still have kind of like pelvic pain and stuff, which could be endometriosis or it could be any of the other pelvic pain generators that we talked about.
Being pregnant and giving birth must have been very difficult and uncomfortable for your mum.
Yeah, yeah.
You know what I mean? Like that's where it's sore. Yeah. You know what I mean? So it's like obviously that would have been extreme, really. You know, so I'm sure she went through quite a lot to have you here.
Yeah, bless her, she did. And she always says that the hysterectomy for her was like a much easier choice because she'd had her 2 children. She was, you know, very happy. So for her, she was like, just get this thing out of me. And she was like, besides you guys being born, that was the best day of my life, was getting that thing out. Like, so yeah, but it's just each of us, we kind of share this same thread of a journey when we have these conditions, but each individual case is so unique. Different. Yeah.
Which I suppose is what makes it so difficult to be black and white about on paper and learn about in school, I suppose.
It's really difficult to diagnose as well as doctors, you know, and properly like know how to treat it, what's best for it.
So obviously then for the likes of your mum, like pre-internet era and stuff as well, it would have probably felt very isolating in a world where you can't access that information very quickly or talk to anybody else about it.
Yeah, she always says to me though that she is just, like her mind is blown with how little we have progressed between the 2 generations. She's like, it's literally like looking at myself that sort of many years, 30 years ago. Yeah, so she just can't believe it.
So probably as well, you would have been massively aware of endometriosis at such a young age because your mum had it. So that was obviously...
So I had to step up.
You were able to go, this might be what I have because I'm in severe pain at 11.
I used to call it endo. So I would nickname it Edna because I didn't have a diagnosis. So I was just like, oh, Edna's being a bitch or Edna's playing up.
Edna the endo?
But then it turned out that everybody I know had an aunt Edna who apparently was really nice. So I felt really bad because I was just like calling their aunt all these names every month. But I was so convinced that I had it that that's what I would text like my friend or say to Chris because of what my mum went through. But it was just accessing the right care and getting somebody to believe it and believe it enough that it was an issue enough to do something about, which was the struggle for sure. Yeah.
What's the, before we finish up, what's the main goal then with your work? You want to get it introduced into the curriculum?
I think education needs to improve at every single touch point, and that includes patients, clinicians, wider support systems, workplaces. So, just a tiny little goal. But yeah, we're going to start with the universities and future clinicians and hopefully get them more kind of clued up and keyed in. I'm also working on a project about women's experience with dismissal and gaslighting in healthcare settings. I think all of us at one point or another have gone to a doctor and sort of been fobbed off a little bit, whether that's not necessarily through the doctor's fault. I don't think any doctor ever goes into that profession because they want to upset somebody or make somebody's life more difficult. But they're very much like tied together, the education piece, we don't know what we don't know. And then the result of that is that we are, seeing diagnostic delays of 8 years, but the truth is more likely it's decades long. So yeah, those are my kind of 2 main projects, and yeah.
And Priya, what were the charities you mentioned a minute ago, if there's anyone who wants to reach out?
So Endometriosis UK, just seeing your GP, they'll be able to refer you on to like a range of different things that might be helpful for you, whether that's like dealing with pain in a certain way, charities that can help with that, or organisations, or like CBT, that kind of thing. So seeing your GP. It's amazing.
And Jen, where can people find you online if they'd like to follow your journey? And
I am pretty much just endometriosis everywhere.
That is so fun.
I was like, this is too perfect not to use it. I was just like, I'm having it. Yeah.
You were born to it.
Although I did go on the radio and they thought that was my name.
Endometriosis?
Yeah. I was like, no.
Were they like, we're joined here by Jen?
Yeah.
Endometriosis?
And I was like, my name's Jen.
Yeah. You're not some Greek god.
Right. I didn't have much luck if that was actually my name. I was like bound to get it, wasn't I?
Well, your mum might have, she had a familiar relationship with endometriosis.
That's true. Just resentment filtered through, so she named me that.
Brilliant. Thank you very much for listening. You can find Jen online if you want to follow her journey, and see you next time. If you have had your ears pricked up by anything in this conversation that we've had today, possibly you think, oh, that's something I could be affected by, you've heard the symptoms and they resonate with you, then we hear you, we see you, we know that you absolutely deserve to be heard and need medical attention. And if that is you, we hope that this conversation has given you the confidence to reach out to somebody, whether it's somebody in your life, somebody who's already in your support network, or a medical professional, because you deserve to get the medical attention that you need, hopefully much sooner than Jen was able to access that healthcare.
So if any of these symptoms resonate with you, or if Jen's story does, then please seek help from your health professional, from your GP. And if you feel like you're not super comfortable talking about it with one doctor, then do talk to another. We are out here, we want to listen, and we're all in this together.